Welcome to Prometheus by Dr. Malik. I know why you're here. You're here because you have a curiosity about male enhancement. And as you should. Studies have shown that over 3 out of every 4 men have thought about male enhancement at some point during their lives. Now, why might that be the case? In order to understand a little bit better, let's go over a couple of gentlemen who came in to see me recently. First guy is Brandon. Brandon, young man, early 20s, business consultant, and I'm doing this procedure, and he's like, "Doc, you won't believe why I'm getting this done." So I tell me, Brandon. And he says that every day when he gets up and takes a shower, he's getting ready for the day, and he sees himself in the mirror, not only is he uncomfortable, but he's embarrassed. He's embarrassed to the extent that he has to run and grab a towel. And that feeling, that thought, is in the back of his mind throughout the entire day. And he's like, "Doc, I can't stand it." Now, fast forward a couple treatments later, and I follow up with Brandon, say, "Brandon, how are things going?" He's like, "Doc, it's going great." Now when I get out of the shower and look at myself, I know and I can see that I'm the man. He has a supreme level of confidence, and he attacks the day and can do anything. And that's how he benefits from this procedure. What's another possible scenario? Let's talk about Joseph. Joseph's middle-aged man, late 40s, married over 10 years, and I'm doing his procedure, and I'm like, "Joseph, why are you getting this procedure done?" He's like, "Well, Doc, I just don't think my relationship is going that well." I said, "What are you talking about, Joseph? How many times do you have sex during the month?" He's like, 2 or 3 times. I'm like, "Okay, and what does your wife say about your performance?" She says, "It's okay, it's fine." He's like, "I just don't want it to be that case." Now, fast forward a couple treatments later, and he's like, "Doc, you won't believe what's happening now. Now, we're having sex multiple times a week. And not only that, she's the one asking me." So the relationship is enhanced and improved to an extreme level. So these are just some reasons why you might want to get it done. Now, how does male enhancement have this effect? In order to understand that, we got to go over some of the anatomy. So this is a model of the vaginal canal, okay? And this is pretty accurate in terms of size of an average vaginal canal, with the clitoris sitting on the top. Now, you have average sized penis. And as you can see, you're stimulating the clitoris. However, we've learned that there are nerves all along the canal. And if you stimulate these nerves, you get much more intense sensation. Now, let's say you have a treatment, okay? Now, we're stimulating a good amount of those nerves, and you'll get a much more intense experience. Let's say you get multiple treatments. With the multiple treatments, now you're what we call wall-to-wall. And what does that lead to? That leads towards faster, stronger, and even multiple orgasms. And you're gonna have experiences you couldn't even imagine. Wow, now you're like, "Doc, I'm sold, let's do it." Well, slow down. First, we gotta go over the different options. So there are predominantly 3 options. First, there's a surgical option, which involves taking fat tissue from one part of your body and putting it around the penis. Now, there are risks with surgery. There's general anesthesia, which has a risk. There's cutting structures that aren't supposed to be cut. And finally, even if you get through all that, most men don't enjoy the feel of the fat tissue when it's placed. Second option, dermal fillers. There are dermal fillers that are used and have been used predominantly in the face by dermatologists, and now can be used in the penile tissue. It works great, feels great. However, 6 to 12 months later, it's gone. So it's not permanent. So why would you want to do a temporary enhancement to your penis? Doesn't make a whole lot of sense. And third, there's the procedure we dub Prometheus. That is not only non-surgical, but more importantly, it's permanent. And that is what sets it apart from the other procedures that are available. So to better understand Prometheus by Dr. Malik, let's talk a little bit about Dr. Malik. That's me. I have almost 2 decades of experience. I've done over 25,000 injection procedures. I have become double board certified. And more importantly, I have worked with a couple of world-renowned cosmetic male enhancement physicians. And through that, we have taken the procedure that was started by Dr. Victor Loria down in Miami, about 15 years ago, refined it, and created Prometheus. In brief, Prometheus involves taking 2 FDA-approved components, which are combined and placed just under the level of the skin. So we're talking 1 to 2 millimeters. So by doing that, we're avoiding the internal structures such as the nerves, the blood vessels, and things that we don't want to hit. After we do that, you keep it wrapped a few weeks, and after a few weeks, I clear you and you're ready to rock and roll. So let's say you're signed up. So what does it involve? Well, you come into our state-of-the-art clinic located in Atlanta, Georgia. You're met by one of our medical assistants. They take you back to the room, put you on some numbing agent. After about an hour, then I come in, introduce myself, get to know you a little bit better, and we set the expectations. It takes me roughly an hour to do the procedure. During this time, most guys are, like I said, sleeping. Some of them are watching Netflix or listening to their phone. So they're doing their thing while I'm doing my thing. And then an hour later, you're wrapped up and out the door. So you come in, a couple hours later, you're driving yourself home. Next day, you're back to work as if nothing happened. Well, something did happen. And a few weeks later, when you're cleared, then you're ready to go. What do I mean by ready to go? Now, you've created collagen tissue. Collagen tissue is about the consistency of your ear, and this tissue is permanent. So now, you have what we call the Superman state. You have supreme confidence knowing that when you walk into the room or the bedroom, that you are the man. You're in the top 2% of all men walking the planet. And with this, you can accomplish anything that you want. So if you're ready, then we're ready. Check us out at PrometheusXL.com. You can schedule a patient advisory consultation and book your procedure, and I hope to see you soon.